Good evening, everybody. This is Dr. Patmos, and it is December 1st, 2025, and I have an important video for you tonight on the infamous Prasad FDA memo. As those of you who follow my posts and follow this subject know, yesterday was a, a very sad day for the United States. The FDA memo written by Dr. Vinay Prasad was leaked to the New York Times and released publicly. This memo will live in infamy. It was, in my opinion, a disgrace. Uh, Let me tell you a little bit about it. First of all, who's Dr. Prasad? Dr. Prasad is an oncologist from UCSF. He has very good clinical credentials. He has no training in infectious diseases, however. And he's a firebrand, anti-vax firebrand with very vile and violent rhetoric in his writings. You just have to look at his Substack to see the vile language that he uses, his flagrant disregard for infection control practices, and his attacks on those physicians and others who work in healthcare administration. Anyhow, he's obviously in charge now at the FDA, and he wrote a memo basically concluding that the COVID mRNA vaccine killed at least 10 children and likely many more. And he based it on an analysis done by Dr. Tracy Beth Hogue, his assistant, who drew this conclusion based on subjective data from the VAERS reports. For those of you who don't know what VAERS is, I've linked or copied below the disclaimer from the VAERS report that says that the data there is coincidental, unverifiable, uncorroborated, and inaccurate and biased. Despite that minor disclaimer, Dr. Prasad and Dr. Hogue, Dr. Makari went on to conclude that the vaccine caused these deaths. You can't do that. You can't use the data that way. It says they're right on the VAERS website, but they did it anyway. And now this memo has been released, and it has been upheld as a vindication for the anti-vax movement that, see, the vaccine did kill children. Up until that memo came out, there's not a single documented case of anyone dying from COVID mRNA vaccine in the United States. But now the anti-vax movement can point to this document and say, see, FDA has admitted it. FDA and Dr. Prasad wrote a memo based upon VAERS data, which is totally unscientific and absolutely unprofessional to use VAERS data this way. In addition to that, his memo is also interesting because he goes on in multiple places to attack President Biden. And why the FDA document should be politically laden with anti-Biden rhetoric is just unprofessional, to say the least. He goes on to set new standards for how vaccines are going to be evaluated and treated by the FDA going forward, which he sets an impossible standard. He wants placebo-controlled randomized trials for all vaccines and all boosters going forward, which is an impossibility. So in effect, FDA is basically gutted the future for vaccines in the United States. When combined with CDC's destruction by Robert F. Kennedy and the CDC Advisory Committee on Immunization Practices, the future for immunization in the United States is very grim. Finally, in a touching final note in his memo, Prasad threatens all the FDA employees and bars them from sharing any of this information with the public. How's that for transparency? And he says that if you don't agree with that, you can submit your resignation to him. So what we have now is a complete takeover of the FDA by a biased zealot who has a fixed belief system about vaccines and is using theirs just as all the other anti-vaxxers do. They misuse VAERS to craft a biased argument and then state conclusively that their data supports that conclusion. It doesn't. The analysis done by FDA and Dr. Hogue and Dr. Prasad has not been subjected to peer review. That data needs to be written in its entirety, in detail, published in a medical journal, and subjected to peer review where others can rip it to shreds, which we will do because that data is garbage. So what we have is we have garbage at the FDA, um, garbage coming out of the FDA that the public is now being exposed to, and half the public will uphold this garbage as truth. This is a very grim thing. I think for the going forward, this is going to really impair vaccine development and regulatory approval in the United States that will result in a significant resurgence of communicable infectious diseases. And years from now, when people look back on this chapter of American history, the Prasad memo will live in infamy. It is a chilling example of bias and misuse of data to promote uh, a delusional system of thinking about vaccines. It's a sad day in America. So if you haven't read Dr. Prasad's memo, you can find it. I've linked to it below. The infectious disease community has responded, and there's a link to that article as well as to what is wrong with Dr. Prasad's memo. Dr. Prasad is an oncologist, and here he is dictating matters policy on infectious diseases. I wonder how he would like it if infectious disease doctors started issuing policies about how we're going to treat cancer. He's out of his league and out of his field, and this is a very sad day. So, anyhow, enjoy the article and uh, good luck.